Do me a favor right now, just where you are. Take a slow breath, swallow once, and pay close attention to what you feel at the very back of your throat. Is there a stubborn heaviness sitting right there? A thick, sticky coating that refuses to budge, no matter how many times you clear your throat or reach for a glass of water? If you are like most people who clicked on this video, this has not just been a nuisance for a morning or two. It has likely become an ongoing, daily battle. You clear your throat when you wake up. You clear it before you speak. You clear it during commercials, at the dinner table, or while reading a book. It is a constant, exhausting rhythm that has quietly taken over your day. If I asked you exactly when this started, you probably could not pinpoint the day or even the month. It did not arrive with a dramatic fever or a sudden cold. Instead, it crept into your life like a quiet shadow. At first, it was just a bit of morning congestion that you brushed off. Then, it started lingering past noon. Now, it is a permanent resident. You find yourself carrying a bottle of water everywhere you go, not because you are thirsty, but because you are desperate to wash away that constant lump. You avoid certain foods, dread quiet rooms where your throat clearing feels incredibly loud, and have tried every warm tea, lozenge, and home remedy your friends have suggested. Yet, that thick sensation remains. I want you to take a deep, reassuring breath and listen to me closely. That mucus is not a sign that your body is failing you. It is not some random, meaningless glitch of getting older. Your body is incredibly intelligent, and it does absolutely nothing by accident. Every persistent symptom, every chronic discomfort, is actually a message written in a language we have to learn to interpret. That mucus is your body's way of trying to protect you from something, but the lines of communication have gotten crossed. Today, we are going to fix that. In my years of working with older adults in preventive medicine and senior wellness, I have seen this exact symptom, persistent, stubborn throat mucus, misunderstood, misdiagnosed, and mistreated more than almost any other condition. Far too often, people in their 50s, 60s, and 70s are handed a generic nasal spray, told to drink more fluids, and sent on their way. The actual underlying triggers sitting quietly beneath the surface are completely ignored. Today, we are going to change that story. I am going to guide you through 5 highly specific, research-supported reasons why you have this persistent mucus, tailored exactly to how our bodies change as we mature. I am also going to reveal something that almost no other health video discusses. I will show you how 2 of these hidden causes are highly likely working together in your body right now, forming a tag team that makes your symptoms twice as intense. My name is Dr. Wellness. My mission has always been simple: to bring you clear, honest, research-backed health guidance without the confusing medical jargon, offering practical steps you can start using tonight to reclaim your comfort. Before we dive into the biology, I want to ask you a very important question. Go down to the comments right now and tell me, is your throat mucus significantly worse first thing in the morning, or does it stay with you consistently all day long? Your answer to this single question is actually a massive clue that points directly to which system in your body needs the most attention. Write morning or all day in the comments. I read every single one of your responses, and they help me understand how to support you best. Now, let us begin by uncovering a fundamental truth about our biology that almost no one is taught, which completely changes how we view this struggle. To understand why your throat feels coated, we first have to bust a major myth. Mucus itself is not your enemy. In fact, your body is a mucus-producing powerhouse, quietly creating between 1 and 2 liters of it every single day, completely behind the scenes. This fluid is actually a brilliant, life-saving shield. It is the protective coating that lines your delicate airways, acting like sticky flypaper to trap dust, pollen, viruses, and bacteria before they can travel down into your vulnerable lungs. It keeps the tissues of your throat moist, resilient, and healthy. Without this continuous lubrication, your airways would dry out, crack, and leave you entirely defenseless against every bug going around. The mucus itself is a sign of a healthy, active immune system. The real issue is not that your body is making mucus, it is that the transit system responsible for clearing that mucus has slowed down. Inside your respiratory tract, there is a fascinating, highly coordinated system known as mucociliary clearance. Picture millions of microscopic, hair-like structures called cilia lining your airways. Their sole job, which they perform millions of times a day, is to wave in a coordinated upward direction, like a gentle broom sweeping dust off a floor. This motion sweeps the thin mucus up toward the back of your throat, where you swallow it completely unconsciously. In a younger adult, this conveyor belt runs at high speed. Mucus is swept away and recycled so fast that it never has a chance to pool. However, clinical studies have confirmed that as we blow out more candles on our birthday cakes, these microscopic cilia naturally begin to slow down. They beat less frequently and with less vigor. This means that mucus, which would have been swept clear in a matter of seconds when you were 40, can now sit, pool, and accumulate for hours at age 65 or 75. Because of this natural physiological shift, any minor trigger that causes your body to produce even a tiny bit of extra mucus is going to feel much more severe and last significantly longer. It is not a design flaw, it is simply how our mature bodies function. Understanding this reality is the first step to finding a real, lasting solution. Now that we understand the natural clearing system, let us look at the 5 specific culprits that can disrupt this balance, starting with the one that is most frequently missed by doctors and patients alike. The first hidden cause we must examine is a condition that is incredibly common but rarely suspected. It is called laryngopharyngeal reflux, or LPR. Now, you are probably familiar with classic acid reflux or heartburn, that fiery, uncomfortable burning sensation in your chest after eating a heavy or spicy meal. But LPR is a far more deceptive, silent cousin of classic reflux. It can occur with absolutely no chest burning, no indigestion, and no stomach discomfort whatsoever. Because of this, millions of people suffer from it for years without ever realizing their stomach has anything to do with their throat issues. Here is how this silent process unfolds inside you. Between your esophagus and your stomach sits a muscular ring, a physical valve designed to act as a one-way gate. Its only job is to open to let food pass down and then snap tightly shut to keep highly acidic stomach digestive juices locked away. As we age, our muscles naturally lose some of their tone, and this valve is no exception. It can become slightly stretched and relaxed, like an old rubber band. When you lie down at night, this weakened valve can allow microscopic droplets of stomach acid and digestive enzymes to slowly slip upward. This vapor doesn't just stop in your esophagus, it travels all the way up into your sensitive throat, your vocal cords, and even into your nasal passages. Here is why this is so critical for your throat comfort. The lining of your stomach is specifically designed to handle incredibly strong acid. The lining of your throat, however, is exceptionally delicate, more like the sensitive tissue on the inside of your eyelid. When even a microscopic trace of stomach acid touches this highly sensitive throat tissue, your body perceives it as a severe chemical threat. To protect this vital area from being burned or damaged, your body immediately goes into defense mode, rushing to produce a thick, heavy blanket of mucus to coat and shield the irritated tissue. This is a brilliant survival mechanism, but when it happens night after night while you sleep, you wake up every single morning with a heavy, thick coating at the back of your throat. You have no idea why it is there, because you did not feel any heartburn during the night. Peer-reviewed research in ear, nose and throat journals shows that up to 50% of people diagnosed with silent reflux report having absolutely no traditional heartburn. Instead, their only symptoms are a persistent morning throat clearance, a voice that sounds raspy or hoarse when they first wake up, and a feeling like there is a pill stuck in their throat. If your mucus is at its absolute worst first thing in the morning, or if you notice your throat feels more irritated when you bend forward or tie your shoes, silent reflux is highly likely playing a major role. Before we move to the next cause, there is a very important connection you need to know if you suffer from joint pain or arthritis. If you regularly take over-the-counter anti-inflammatory medications like ibuprofen, naproxen, or aspirin, medical research has firmly established that these drugs can weaken the natural protective barrier of your stomach lining. This makes stomach acid much more aggressive and significantly increases the likelihood of silent reflux developing or worsening. If you take these medications daily, this is a vital piece of the puzzle to discuss with your doctor. Now, let us move on to our second hidden cause, which often works hand in hand with the first. Our second culprit is a slow, silent form of sinus irritation that goes completely unnoticed by most adults. When we think of sinus trouble, we usually picture the dramatic, acute version. A severe sinus infection with throbbing facial pain, pressure behind the eyes, a completely stuffed nose, and a fever. But in adults over 55, sinus issues rarely show up with such loud, obvious signs. Instead, the sinuses can become mildly, chronically inflamed. Your nasal passage might feel mostly open, and you can breathe through your nose quite well. But behind the scenes, this low-level inflammation causes your sinuses to constantly drip a thin, steady stream of excess mucus down the back of your throat. This continuous hidden drainage is known as postnasal drip. A notable clinical study published recently confirmed that the average age of individuals presenting to clinics with chronic postnasal drip is exactly 55. It is a very specific, age-related pattern. The tragedy of this condition is how people try to treat it. Many folks assume that since they have drainage, it must be allergies, so they head to the local drugstore and buy over-the-counter antihistamines. They take these pills daily for months, only to find that their throat feels even more uncomfortable. Here is why that happens. Antihistamines work by systematically drying out fluids in your body. While they might slightly reduce the amount of mucus, they make the remaining mucus incredibly thick, sticky, and dehydrated. Instead of a thin, easily cleared fluid, you are now left with a dry, cement-like coating stuck to the back of your throat that your slowed-down cilia simply cannot sweep away. You have essentially traded one uncomfortable symptom for an even worse one. Clinical research has shown that one of the most effective, safe, and inexpensive ways to address this chronic sinus inflammation is not through drying medications, but through a gentle, high-volume saline nasal rinse. A major clinical review published in the medical journal Medicina analyzed a wealth of data on respiratory health and concluded that nasal saline irrigation is one of the absolute best, low-cost strategies for treating and preventing chronic upper airway inflammation. It is widely recommended by nose and throat specialists across the globe. By gently rinsing your nasal passages with a warm, saline solution, you physically wash away the built-up inflammatory mucus, soothe the swollen tissues, and directly support those tired cilia, helping them regain their natural sweeping motion. The magic word here is consistency. A single rinse will give you temporary relief, but committing to a daily routine allows the tissues to truly heal over time, breaking the cycle of constant throat clearing. I will guide you through the exact, safe method for doing this in our step-by-step action plan shortly. If you are finding this information eye-opening and helpful, please take a quick moment to subscribe to the channel, hit that notification bell, and type the word clarity in the comments below. Your support is what allows us to keep creating these deep-dive, research-backed guides for our community. This brings us to our third hidden cause, and it is one that almost always catches people completely off guard. When my patients sit down with me to trace the origin of their throat issues, they are usually looking at their diet, their environment, or their allergies. They rarely think to look inside their medicine cabinet. There is an incredibly common class of prescription medications used to treat high blood pressure called ACE inhibitors, which stands for angiotensin-converting enzyme inhibitors. You might know them by their chemical names, which typically end in the letters PRIL, such as lisinopril, enalapril, or ramipril. These medications are life-saving tools prescribed millions of times a year to protect cardiovascular health. However, they carry a very specific, well-documented side effect that is frequently missed by both patients and busy clinics. ACE inhibitors work by blocking a specific enzyme in your body to help your blood vessels relax. But this same enzyme is also responsible for breaking down a natural inflammatory substance in your body called bradykinin. When you take an ACE inhibitor, bradykinin begins to slowly accumulate in your respiratory tissues. For a significant portion of people, studies suggest between 5 and 20% of all users, this buildup of bradykinin triggers a localized, chronic irritation in the airway. This irritation manifests as a persistent dry tickle, an ongoing urge to clear the throat, and a physical increase in localized mucus production as your throat tries to soothe the dry irritation. Crucially, this is not an allergic reaction, and it does not mean your medication is toxic. It is simply a direct physiological side effect of how the drug behaves in your body. The reason this connection is missed so incredibly often is the delayed timeline. In many cases, this throat irritation does not start the day you take your first pill. It can take several weeks or even up to 6 months to slowly build up in your system. Because of this long delay, when you start clearing your throat constantly in October, you never think to connect it to the blood pressure pill your doctor prescribed back in March. A large-scale medical study tracking over 27,000 patients revealed that adults over the age of 65 have a 53% higher likelihood of developing this specific throat-clearing side effect compared to younger patients. If you are taking a medication for blood pressure and are unsure if it belongs to this class, you do not need to wait for a doctor's appointment to find out. Simply call your local pharmacist. They can tell you in less than 30 seconds. If your medication is indeed an ACE inhibitor, and you suspect it is behind your symptoms, there are excellent, highly effective alternative classes of blood pressure medications available, such as ARBs or angiotensin receptor blockers, which control blood pressure just as effectively without causing this frustrating throat irritation. This is a highly valuable conversation to have with your healthcare provider. Now, let us turn our attention to the fourth cause, which seems so simple that most people completely dismiss it, yet it has a massive physiological impact on how your throat behaves. The fourth cause is the vital topic of hydration, but I want to explain this in a way you have likely never heard before, because it goes far deeper than the standard advice to drink more water. As we established earlier, your mucus is not a solid block. It is a fluid composed of roughly 98% water. The physical consistency of your mucus, whether it is thin, watery, and easy to swallow, or thick, sticky, and glued to your throat, is entirely dependent on the hydration status of the tissues surrounding your airway. To understand this clearly, think of a bottle of pure maple syrup. When it is warm and fresh, it flows quickly and smoothly. But if you leave that bottle open in a dry, cold room overnight, it becomes incredibly thick, sticky, and slow-moving. Your mucus behaves in the same way. If your body is well hydrated, your mucus remains thin and moves effortlessly along the ciliary conveyor belt. If you are even slightly dehydrated, that mucus dries out, thickens, and turns into a sticky gel that clings to your throat like glue. Now, here is the critical age-related detail that makes this a major issue for adults over 55. As our bodies mature, the internal thirst mechanism located in our brain naturally becomes less sensitive and less reliable. When we are younger, our brain alerts us that we need water long before we actually become dehydrated. But as we age, this early warning system becomes significantly blunted. This means you can be walking around in a mildly dehydrated state, with your tissues crying out for water and your mucus thickening by the hour, without feeling particularly thirsty at all. If you are waiting until you feel thirsty to pour a glass of water, you are already operating far behind the curve. This chronic, low-level dehydration, maintained day after day, keeps your mucus in a permanently thick, sticky state, amplifying the discomfort of every other cause we are discussing today. A widely respected guideline in clinical nutrition suggests aiming for a daily fluid intake of approximately 30 milliliters of water per kilogram of body weight. For a person weighing 170 pounds, that translates to roughly 2.5 liters of fluid daily. This does not mean you have to chug endless gallons of plain water. Herbal teas, low-sodium broths, and moisture-rich foods like cucumbers, celery, and citrus fruits all count toward this goal. The key is to make hydration a conscious, scheduled habit throughout your day, rather than a reaction to a thirst signal that may no longer be working properly. Let us now explore our fifth cause, which is perhaps the most fascinating and cutting-edge area of modern medical research, connecting your throat to a part of your body you would never expect. Our fifth cause takes us far away from the throat and the sinuses, down into your digestive system, to examine a highly significant pathway known as the gut-lung axis. For many years, medicine treated the different systems of the body as if they were completely isolated compartments, as if what happens in your colon has absolutely no bearing on what happens in your throat. But modern clinical science has completely shattered this old way of thinking. We now know that your respiratory system and your digestive tract are deeply interconnected through a complex network of nerves, chemical messengers, and immune system pathways. At the center of this connection is your gut microbiome, the vast community of trillions of bacteria and microorganisms living in your intestines. When your gut microbiome is balanced and healthy, it sends calming signals to your immune system, keeping inflammation low throughout your entire body. But when this delicate ecosystem is disrupted, a state medical researchers call dysbiosis, it triggers a systemic immune response. This chronic, low-grade inflammation can travel along the gut-lung highway, causing the mucous membranes in your airways to become hypersensitive and hyperactive, producing excess, thick mucus in your throat as a protective reaction to a distant alarm. A series of landmark clinical studies published in leading medical journals, including the American Journal of Respiratory and Critical Care Medicine, have confirmed this direct physical connection. Researchers discovered that when the gut microbiome is compromised, immune cells in the lungs and airways are primed to overreact to normal daily particles, leading to chronic airway inflammation and mucus overproduction. Even more fascinating, laboratory studies have shown that transplanting healthy gut bacteria directly correlates with a reduction in airway inflammation. What causes this gut disruption in older adults? It is often a combination of common, everyday factors: a diet that has become lower in prebiotic fiber, the cumulative effect of taking multiple courses of antibiotics over the decades, a high intake of processed sugars, and chronic, low-level stress. None of these is rare or exotic. They represent the daily reality for millions of mature adults. You cannot cure a gut-lung axis issue with a cough drop or a throat spray, because those temporary fixes never reach the root of the problem. True healing requires supporting your digestive health from the inside out, which we will address specifically in our upcoming action plan. Now, before we assemble all of this into your complete daily routine, we must pause for a moment to discuss a few highly important health signals that require professional medical evaluation rather than self-management. While the vast majority of cases of persistent throat mucus are completely benign, easily managed, and related to the everyday factors we are discussing, your body will occasionally use its voice and throat to signal a deeper issue that needs direct medical attention. As a healthcare professional, I want to make sure you are equipped with the knowledge to recognize these signs. Please make an appointment to see your doctor promptly if you experience any of the following warning signs. Mucus that is consistently tinged with red or pink blood, even in very small amounts. A progressive difficulty in swallowing food, liquids, or your own saliva that seems to be getting worse over several weeks. Unexplained, rapid weight loss that occurs alongside your throat symptoms. A visible lump, swelling, or persistent tenderness in your neck area, or a significant raspy change in your voice that persists for more than 3 weeks without improving. These specific symptoms go beyond the scope of simple lifestyle adjustments. If you notice any of them, please do not try to manage them on your own. Be proactive, schedule a visit with your physician, and get a professional evaluation to ensure your safety and peace of mind. For the overwhelming majority of you watching, however, your persistent mucus is a functional issue that you can begin addressing tonight. Let us dive directly into your comprehensive, step-by-step action plan to clear your throat once and for all. Our action plan is structured chronologically, starting with what you can do tonight to set yourself up for a clear, comfortable morning. First, make a firm commitment to stop consuming any food or caloric drinks at least 3 full hours before your head hits the pillow. When you eat a late snack and then go to sleep, your stomach is filled with active digestive juices and food. Gravity is no longer assisting you, and that weakened esophageal valve we discussed has to work twice as hard to keep acid contained. By giving your body a 3-hour window of upright time before sleep, you allow your stomach to fully empty, drastically reducing the chance of silent reflux occurring during the night. Second, elevate the head of your bed. Now, I want to be very clear about this. Do not simply stack extra soft pillows under your head. Doing this actually bends your neck, compressing your airway and putting more physical pressure on your stomach, which can actually worsen reflux. Instead, you want to elevate the entire torso at a gentle, continuous angle. You can achieve this easily and comfortably by purchasing a firm foam wedge pillow designed for reflux, or by placing solid wooden blocks or bed risers under the 2 legs at the head of your bed frame, raising them by about 10 to 15 centimeters. This slight incline utilizes the natural power of gravity to keep stomach juices where they belong, preventing them from traveling up to irritate your delicate throat tissues while you sleep. To finish your evening routine, drink a small cup of warm, plain water about 30 minutes before bed. This simple act provides a crucial dose of hydration that helps keep your mucus thin and fluid overnight, preventing it from drying into a sticky layer while you breathe in your sleep. When you wake up tomorrow morning, your recovery continues. Before you reach for your morning cup of coffee and before you sit down for breakfast, drink 1 to 2 full glasses of warm, plain water. This single, cost-free habit is one of the most powerful things you can do for your airway health. During the night, your body naturally loses moisture through breathing, leaving you in a mildly dehydrated state. Drinking warm water first thing in the morning immediately rehydrates your body from the inside out, physically flushing your throat and thinning out any mucus that has accumulated overnight before it has a chance to harden and bother you for the rest of the day. Many of my patients report that this simple morning water habit alone completely transforms how their throat feels within just 1 week. Next, head to your local pharmacy this week and purchase a simple nasal rinsing device, such as a neti pot or a gentle squeeze bottle designed for sinus irrigation. You must use only distilled, sterile, or previously boiled and cooled water for this process. Never use water straight from the tap. To your warm, sterile water, add a pre-measured packet of saline powder or mix a small pinch of non-iodized salt and a tiny pinch of baking soda. This mixture creates a soothing, balanced solution that matches your body's natural fluids. Gently rinse each nasal passage once a day, preferably in the morning. This process physically washes away the chronic, irritating inflammatory markers, pollen, and thick mucus from your sinuses, while directly soothing the tissues and helping your natural cilia sweep more effectively. Please commit to doing this daily for at least 2 full weeks before deciding if it is working. The benefits of sinus rinsing are cumulative. Consistency is what separates those who find relief from those who do not. Now, let us address your medication list. I want you to sit down today and write down a brief timeline of your health. Note exactly when your throat clearing and mucus symptoms first became a daily issue, and compare that to any dates when you started taking a new medication or changed your dosage. If you are taking a prescription for high blood pressure, call your pharmacist or look up the label to see if it is an ACE inhibitor. If it is, schedule a conversation with your prescribing doctor. Bring your timeline with you and ask them if it would be safe and appropriate to trial an alternative medication, such as an angiotensin receptor blocker, to see if your throat clearing resolves. Never stop or alter your blood pressure medication on your own, but remember that you are an active partner in your healthcare, and this is a completely standard, highly reasonable request that doctors handle every single day. To support the vital gut-lung connection we explored, make it a daily goal to introduce 1 small serving of a high-quality, fermented food into your diet. This could be a half cup of unsweetened plain Greek yogurt with active cultures, a glass of traditional kefir, or a small side of naturally fermented sauerkraut or kimchi. These foods are packed with beneficial live bacteria that help restore balance to your gut microbiome, dampening the systemic inflammation that drives mucus overproduction in your airways. At the same time, make a conscious effort to boost your daily hydration by keeping a reusable water bottle in the rooms where you spend the most time, such as next to your favorite chair or on your nightstand. If plain water feels boring, try infusing it with a slice of fresh lemon, lime, or cucumber, or enjoy a cup of warm, caffeine-free herbal tea. By making fluid intake a regular, non-negotiable part of your daily routine, you prevent your body's hydration levels from dropping below the threshold where mucus begins to thicken. Before we conclude, let us briefly look at some of the most popular home remedies that are widely discussed online, so you know exactly what works and what to avoid. Honey is a wonderful natural demulcent. It has natural soothing properties and forms a temporary protective film over irritated throat tissues, making it an excellent, safe way to calm a sudden tickle or cough. However, while honey is soothing, it does not address the underlying causes of mucus production, so it should be used as a comfort measure rather than a cure. Dairy is another highly debated topic. You have likely heard that you must avoid milk, cheese, and yogurt because they create excess mucus. Interestingly, modern clinical science has shown that dairy does not actually cause your body to produce more mucus. However, the proteins in milk can temporarily bind to your existing mucus, making it feel slightly thicker and more noticeable in your mouth and throat. If you personally notice that your throat feels more coated after eating dairy, it is completely reasonable to do a simple 2-week trial where you reduce your dairy intake to see if your comfort improves. Lastly, we must discuss apple cider vinegar. This is a very popular recommendation on the internet for almost every health complaint. But if your throat mucus is being driven by silent reflux, introducing highly acidic vinegar into your system can actually severely irritate your esophageal valve and aggravate your throat tissues, making your symptoms significantly worse. Please use extreme caution with this remedy if you suspect reflux is your primary issue. I want you to walk away from our conversation today with a deep sense of clarity and hope. That persistent, heavy mucus coating the back of your throat is not an unavoidable consequence of getting older. It is not something you are forced to simply tolerate for the rest of your life. It is a highly specific, physical response to identifiable factors. Silent reflux whispering up from your stomach while you sleep. Low-level sinus inflammation draining quietly down your throat. A side effect from a common blood pressure medication. A natural decline in your body's thirst signals leading to thick mucus. Or an imbalance in your gut microbiome, sending inflammatory signals through your body. Every single one of these causes has a practical, research-supported response that you can start implementing today without a specialist or an expensive prescription. It simply requires a little bit of knowledge, a commitment to consistency, and a willingness to listen to your body's signals. You deserve to speak clearly, to swallow comfortably, and to wake up every morning feeling refreshed and clear. If you found this guide valuable, please subscribe to the channel and turn on your notifications. I have a deeply important video coming up very soon where we will explore the profound connection between gut health and the chronic inflammation patterns that drive joint discomfort and fatigue in our mature years. You will absolutely not want to miss it. Please share this video with one friend or loved one who has been quietly struggling with this same throat-clearing issue. Your simple act of sharing could completely change how they understand their own health. Thank you so much for spending your time with me today. Take great care of yourself, and I will see you in the very next video.